Welcome. This is our 9th annual Global Health Case Competition. And this year, obviously, is a unique format of doing this. In the past, every year, we've had a live celebration, if you will, a day-long, hectic, lots of food, lots of energy, lots of nervousness in a Global Health Case Competition. This year, for very obvious reasons, we are on a Zoom platform, on an online format. And as many of you already know, the first round of this deliberations has already occurred. We had 15 teams from various schools, undergraduates and graduate students at the University of Minnesota submit their presentations in 10-minute formats. And a panel of judges judged the 15. It was a difficult one because we were pretty close in many of the rankings. And that in itself talks about the variety of presentations we have from across the University of Minnesota. So today's 3 teams, I'm sure the rest of you will notice this, you're in for a treat. They put an amazing amount of effort in putting together the presentation, and they're here for our final round of presentations. And as many of you know, the winner of this will be going to nationals at Emory University later this year. And we'll give you more particulars of that later. So today we're going to have this as the final round of presentations. Unlike the first round, this is not a recorded presentation. This is a live presentation on a Zoom platform. And we have today 3 amazing judges who have given us their time to judge this. It's my privilege today to introduce the first judge today would be Dr. Karthik Natarajan. Professor Natarajan is an assistant professor of supply chain and operations at the Carlson School of Management at the University of Minnesota. His interests are about socially responsible operations, specifically in global health, particularly considering supply chains. And this is one of the reasons why we are excited. Global health is such a vast field, and you folks are from different backgrounds. So this is not just the traditional health sciences involved in global health. And Professor Natarajan has demonstrated that. His research has been published in many leading journals, including manufacturing and service operations management. He served as a consultant to various global health agencies, including USAID and many Minneapolis-based nonprofits. He's quite a public-facing person, having been interviewed in many media outlets, including the New York Times, the Star Tribune, PBS, and others. And Professor Natarajan, we're thankful for your presence today. We appreciate you taking your time.
Thank you so much. It's my pleasure. Looking forward to being here.
Thank you. Our next judge is Professor Joshua Ryan. We call him Josh because he's been associated with the center for many years. Dr. Ryan has a very broad background in both global health and infectious diseases, particularly in HIV-related work and CNS infections. He spent a lot of time in Uganda, where predominantly his work was about immunotherapy, cryptococcal meningitis, and other AIDS-related opportunistic infections, as well as HIV immune reconstitution inflammatory syndrome, or IRIS. Like I was mentioning, he's been associated with the center for a long time and was based in Kampala, working with the Infectious Disease Institute in Kampala, Uganda from 2012 to 2019. In this role, he was also a huge mentor for a lot of University of Minnesota students who are visiting or working in Uganda. He remains closely associated with the center. So again, Dr. Ryan, I appreciate your time. He is an amazing mentor, and you will notice in his remarks and otherwise, he's always looking for the betterment of the students. Thank you again, Dr. Ryan.
Thank you. My pleasure. Looking forward to the presentations. Thanks for inviting me.
And our third judge, interestingly, I feel that we should contract him because if you notice the slide, he's the model up front. Matteo Frumholz is a former competitor in this competition. He's a winner of the winning team. He represented the University of Minnesota at the Nationals, and he served as a coach He is an epidemiologist at the Minnesota Department of Health, Refugee Health Program. He joined Minnesota Department of Health in 2018 as a student worker, and since that time has had multiple roles within MDH. He's also been a huge part of our center, always willing to give us time, energy, and effort to our work. Again, Matteo, I really appreciate you taking your time, and thank you for the wisdom you bring to this.
Thank you, Dr. Prasad. Morning, everyone. Yeah, really excited to be here and hear more about your awesome proposals.
Perfect. So today, I just want to give you folks an overview. Like we mentioned, this is the 9th year we're doing it, and it's slightly different than before. We will keep a very tight schedule. And part of the reason we want to keep the tight schedule is we don't want to give one team an advantage over the others. The 3 teams have been selected to present by random allocation. We had no specific reason as to why one team should go ahead of other, besides a coin flip. The presentations will be for 10 minutes, 10 minutes sharp, and then we'll yank the presentation off. And then you'll have 5 minutes for question and answers from the judges. Again, a reminder to everybody here, please keep your audio muted during this time. I would also encourage you to put yourself on video mute, except for the team presenting, so we can see the team members better too. If you have any particular questions or you're having any technical problems, please enter that in the chat box and we'll keep monitoring that. I want to remind everyone today that we are recording this session for future use and obviously for dissemination. If you have any concerns about this recording, please let us know and we can talk about that offline. And so today, a quick mention of how the timing is going to go. The first presentation is going to go from 10:10 to 10:20 with a question and answer at 10:20 to 10:25. The second presentation would be from 10:30 to 10:40 with a question and answer to follow at 10:40 to 10:45. The third presentation between 10:50 and 11 with the question and answer at 11 o'clock to 11:05. Between 11:10 and 11:40, there'll be judge deliberations, and we have a treat coming your way during that judge deliberations. Judges will be moved to a different room. And then we'll have the team all come together, the judges all come together, and at 11:45 we'll announce the winners and the next steps. At 8 minutes of your presentation, one of our center staff, Molly McCoy, will give you a warning. That is when you have 2 minutes left in your presentation. And then a warning as a direct message when time is up. So we are ready to go. If you have any questions about this format, please put it in the chat box right now. Again, you will receive a 2-minute warning from Molly McCoy and a warning in direct message and another notice when time is up. Please note that when your time is up, you will be automatically muted. So the first team to go forward, are you ready?
Yes.
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 So I'm going to lean on Anna Pendleton from our center to arrange for the first team to start their presentations.
All right, I'm opening up the breakout rooms for the other teams to go where you'll be waiting until your presentation. And when your presentation time is, when it's time for you to do your presentation, I'll pop into your breakout rooms and let you know that you can join. So I'll open up those rooms now. It should be just those teams, 1 and 5. And once they're all out, then we can, I believe team 12, you've been given the co-hosting rights to share your screen. So once the other groups have gone into their breakout rooms, then we can give you the go ahead in just maybe 30 seconds here.
And don't worry, the timer will start when you start.
Okay, I'm going to share the screen.
Great, I think you are ready. You can go ahead whenever you're ready.
Greetings, we are the Multidisciplinary Board. Given the information we have been provided, we have came up with a comprehensive playbook, Playing Offensive Against Virus X, where we aim to bat the virus. Our team members will now introduce themselves.
Hi, I'm Bella.
I'm Karen.
I'm Esma.
I'm Chen Wei.
I'm Moria.
First, we will address how to prevent a national and worldwide pandemic.
We will begin by reviewing our key initial public health recommendations. We believe that there is only one option, as with cricket, and that is to go big or go home. The most important first step is to identify and speciate virus X. We recommend doing this in conjunction with the Indian Institute of Medical Research and the National Institute of Virology. Dr. Balan Bhargava was key in helping with COVID identification, and we recommend using his expertise. Maintaining working case definitions is key, and understanding the difference between this virus, dengue, and malaria are discussed in Appendix A. We recommend notification of the WHO within 24 hours of a new case and have provided a national, state, and local infrastructure to do so as an Appendix B. We strongly recommend the creation of a virus task force to disseminate information via daily press briefings and to maintain a transparent relationship with the public and the media. Roles are described in Appendix C. They will be the source of truth and provide vetted data and intel in conjunction with the media. Surveillance should be done via screening questionnaires, as noted in Appendix D, per the National Institute of Epidemiology and Department of Health Research. Finally, strict quarantine measures, as noted in Appendix E, are recommended in alignment with current WHO recommendations for travel, and we recommend preemptive clear contingency plans for national lockdowns as in Appendix F.
The Jomkin model is used to utilize a multi-sectored approach to health and development. In applying this to the urban area, we are looking to target and identify impoverished communities, especially slums. This is to encourage preventative health and help prevent misinformation for migrants and those living in poverty within Mumbai, as this is 50% of their population. We suggest working with the Directorates of Health Services to train leaders in impoverished communities as health workers. We will then work with local healthcare organizations to form a mobile health team to conduct preventative measures and help to provide information. We also recommend working with the extensive Community Health Department to recruit social workers and resources for the team. Hospitals will work in collaboration with the Directorates of Health Services to increase accessibility of health services to those living in poverty. They will also help in training workers.
In order for the games to proceed, spread within the urban slums must be mitigated to prevent a widespread outbreak. By investing in preventative measures in this population now, less will be spent in the future, and the economy will benefit from the World Cup proceeding as scheduled. We propose a bottom-to-top approach in which community leaders such as the Panchayati Raj and other local NGOs like Dasra are appointed to lead the response on the ground while reporting their needs to the BMC and Directorates of Health Services, as they can provide resources to improve weak links in infrastructure. This includes hand-washing stations to increase sanitation and food and financial assistance programs to help encourage individuals that live hand-to-mouth to isolate if they feel sick. We also propose that you sponsor free transportation to health clinics, as it can literally save lives, which will prove a better outcome for your global image. Strengthening the health infrastructure of low-income populations and speeding ahead of the virus will protect against lost productivity in an already weak economy, and these better preventative healthcare measures will save thousands in the future, on top of decreasing the load on understaffed medical systems. All in all, Being a part of this effort in the community will significantly boost your philanthropic image and reflect greatly on the Prime Minister's administration while they are both under an international spotlight.
Next, we will address how we plan to mitigate fear of another outbreak in bioterrorism.
As we enter a corridor of uncertainty, it is imperative to address the Pakistani bioterrorism rumor. We recommend improving the standard operating procedure by applying WHO risk communications plans to India's national risk communication. Also, establish partnership with Facebook India Head to have first-hand information from the Virus Task Force, BCCI, and other credible sources to prevent and flag for misinformation. It is essential that individuals hear from credible sources and leaders to openly answer frequently asked questions from the population, which would then be broadcasted on social media platforms such as Facebook, YouTube, and through opt-in SMS, as a large percentage of individuals use these platforms. The risk communication response must be handled with timeliness, with transparency, targeted, and be accessible, especially since India's COVID-19 response was handled poorly. We believe this approach will reduce panic and the spread of misinformation or rumors. We will use the multivocal approach, allowing multiple stakeholders to be in constant consultations, data sharing, and discussions. It is essential to have these stakeholders, such as the Virus X Task Force, providing updated information on the research and surveillance. Also, the NGOs providing resources for individuals in need. This will be the best time to show BCCI's involvement in preventing an outbreak and are working closely with the governor, the task force, to ensure the safety of patrons for the 2023 World Cricket Cup. These collaborative partnerships and communication ensure grassroots level penetration of key messaging and streamlining communication flow at macro and micro levels while restricting the scope of fake news or rumors. We'll be offering an optional app specifically for Cricket Cup attendees that will provide information about the games and resources for staying safe. While this app will have contact tracing included, there will be a public privacy policy to allow for transparent communication. Awareness campaigns via SMS, which being the most accessible form of communication in India, and an info hotline will help keep people informed on the virus's most recent updates. Proper communication is crucial as we are playing offense to bat Virus X.
Finally, we will address how we will preserve the economic interests of Mumbai and India.
We will work closely with the task force, the International Cricket Council, and WHO to confirm resumption of activities. In order to minimize potential economic loss, we recommend the BCCI to develop a business continuity plan based on the two following resources: the WHO Mass Gathering Sports Addendum for risk assessment, as well as the ICC Medical Budget Planning Form. A virtual engagement plan could be helpful to create a safer environment and make up for potential revenue loss. We realize that there are risks specific to cricket. In order to minimize them and prioritize safety of all people, we strongly encourage the BCCI to develop a new standard operating procedure based on the existing one. Etiquette rules and game regulations should be abided by all competing teams and spectators. They should take full responsibility if any violation occurs. A resource handbook could be a useful educational tool prior to games for all World Cup attendees. BCCI should also work closely with host city cricket associations. A game checklist should be provided, and if there are any confirmed or suspected cases, they should immediately follow the report protocol.
The reason why we invested 30% into treatment, prevention, and surveillance is because we know that a strong offense will be more effective in the long run. Because it doesn't hurt to be prepared, we also propose defensive measures in contributing to the medical stockpile of antivirals and PPE for clinics and hospitals to have what they need on hand when they need it. Human capital allows us to train more workers in surveillance and prevention. Our timeline acknowledges both immediate needs as well as long-term goals in order to ensure preventative measures, which will contribute to the long-term needs. Cricket isn't life or death, it's much more important. We are asking for your time and collaboration in supporting the Bat the Virus pledge. By following our playbook, our team will win against Virus X. We would like to thank you for your time. Together, through prevention, perseverance, and mitigation, we combat the virus.
Thank you. Judges, question and answer session, please.
I can get it started. Thank you so much for your proposal. One of the things that we learned during the COVID outbreak was that, as soon as, especially our migrant workers, stopped going to work, they quickly either went to other parts in India or they went back to their home countries. So I'm curious, kind of what your proposal outlines in terms of, lockdowns or restrictions, or how you're kind of engaging them, or what's the plan for making sure that people don't disperse at that point in time?
Well, I can answer to how we're going to help those migrant workers be motivated to quarantine or isolate in place. So we propose financial and food assistance programs that will be delivered right to them. And then also free transportation to health clinics should they need advanced medical care. Because the reason that they go to other places is because they need to provide for their families, they need work. So if we're giving them the resources that they need to support their families, then they'll be more motivated to stay in place. And I know, Esma, you can talk about the lockdown component.
Yes, I can address the lockdown question. So we would aim to recommend an approach that is not heavy-handed and recommending a strict lockdown procedure. So we've sort of thought of this process ahead of time to look at cases per 100,000 per state. And based on the severity of cases, we recommend mitigation measures. So our hope is that we remain in the medium risk zone with face masks, hand washing, social distancing. But as cases rise, we have the capability to recommend more strict measures to close. This will be done at a per week or even a per day basis. And we will use our task force to convey this information to the public so that they're aware of changes as they occur.
To add to my colleagues, we know that the migrant movement was also contributed to poor PR. And so we know that by having that frequent communication and also more accessible communication to the migrant workers through WhatsApp, through SMS messaging, as well as making sure that it's clear that they are, that they should not disperse and that we have the necessary resources, then we are certain that they should be able to stay in place.
Thank you for the great presentation and for answering the first question. I'm wondering also, I know it's part of one of your appendix as well, but I'm wondering if you could discuss your viral task force a little bit. Who do you plan on being in the task force and why you chose those people?
Yeah, so this is a nice example of who we expect to be on the task force or recommend to be on the task force from a macro and a micro level. We really want to make sure we maintain a strong relationship between the government and the scientific community. And so we want individuals from the cabinet, Home Secretary to be involved along with the Prime Minister. And then from the micro level, we would want to initiate a chief medical officer and his or her committee to take charge of specific virus X affected and suspected districts, and working individually with each state. And then specifically at the World Cup, we'd want to engage a tournament medical manager to help with kind of the surveillance and the communication to the actual attendees and team members. And we hope by using both the government resources as well as our scientific community, we can maintain strict lines of communication and also transparency as well.
And to add on this, specifically for the World Cup, so we will have the report protocol for the World Cup. So if there are confirmed or suspected cases, so they will immediately report to so we have the independent match day doctors, and also we have the tournament medical manager. And the tournament medical manager will relay the information to the chief medical officer of every state, which Asma just talked about. And so the chief medical officer will then give the information to the Department of Health Research. And so the Ministry of the Health and the Family Welfare will relay this information to the task force again, and then we will report it to the Prime Minister.
Thank you. That's the end of the 5 minutes Q&A. Thank you, team. You'll now be moved to a break. You'll allow to be stay in the main room while we bring the next team around.
Okay, thank
We
you.
have kept a brief transition period, understanding some of the technical challenges of doing this. So before the next team comes in, I just want to remind everyone to please keep your audio muted. And judges, thank you. The Q&A went beautifully in terms of time and others.
The help from the McDonald's.
Hi guys, you can come back in just using the leave room button at the bottom right, left. You know how Zoom works, but you're welcome to join the rest of the group.
Okay.
Operating recommendations for that too.
All right, we should be having team one joining back into the group. I just have to give the co-hosting abilities here. So give me 1 second for that. Okay, that should be all set. Do we want to take just 2 minutes of downtime for everyone to reset and let the team know when they're ready to go, or what do we think for time?
And I think, why don't we get started at 10:30, and I'll cue the team to get started at 10:30.
Perfect, thanks.
So for folks in the main room, I just want to remind you that when the first team, which was team 12, was presenting, team 1 and team 5 were kept in a breakout room, and they did not hear the presentation ahead of them. However, since team 12 already presented, now they've joined us in the main room. Team 1, are you ready?
Yes.
Yep.
Yes.
All right. Just counting down the seconds, sorry.
Okay.
All right, you can get started.
All right. Good morning, everyone. We are Team 1, and we are here to introduce our intervention, Bowling Over OPVID-23 in Mumbai. Our primary goal is to contain the spread of OPVID-23 in Mumbai, protecting the locals, teams, tourists, and the migrant workers. We opt for an all-exhaustive approach that incorporates community-led actions and partnerships with formal institutions. Our intervention will protect the World Cup through detailed planning and transparent communication, and will contribute to the long-term economic growth of India. We will engage with stakeholders ranging from the community to the international level.
The key differentiating symptom between OPVID-23 and other monsoon diseases such as malaria and dengue is the presence of blisters on the lips and ulcers on the mouth. This is also the distinguishing factor between suspected and confirmed cases of the illness. As of now, there isn't an official diagnostic test for OPVID-23, and the only way to determine a case of OPVID-23 is through the presentation of blisters and ulcers. The Central Bureau of Investigation also does not believe that this is a case of bioterrorism. However, we will still conduct timely surveillance, study prior cases of bioterrorism, and continue epidemiologic investigations into OPVID-23. Additionally, to make progress towards developing a diagnostic test and a vaccine, we will partner with genome sequencing facilities to extract the virus's genome. To create quarantine centers, we will be converting select buildings around the Dharavi perimeter, as well as near the stadium. We will also be using existing Mumbai properties that have been converted into quarantine facilities, assuming that these are still remaining after COVID-19. Also listed here are the recommended quarantine and isolation protocols supported by the WHO.
We've identified 4 components to ensure the safety of foreign travelers. Through the help of CDC and WHO, we effectively communicate the presence of the disease in Mumbai, as well as up-to-date health information to global leaders. This helps establish travel advisories in their respective countries, especially in the nations where the 9 other cricket teams originate. Teams will also have increased security measures during their stay. Screening measures at the Mumbai airport will be implemented as soon as possible. This will help identify any possible cases in foreign travelers, regardless of whether they're departures or arrivals. Foreigners will also be recommended to quarantine or isolate for 5 days after the games. Compliance is essential for India's success in hosting the World Cup, as well as containing the spread of the disease. During the opening ceremony and games, guidelines will be enforced in stadium by the BCCI, and public non-mask wearers will be fined. One of our main focuses is the containment strategy for Dharavi, as the majority of all OPVID-23 cases originate here. A community-led comprehensive containment strategy supported by collaborative partnerships is utilized. This allows us to leverage existing local resources and build trust going forward, which is essential for smooth and effective implementation of our strategy. Training is conducted to build Dharavi's capacity for protecting the locals. So healthcare providers will train the community healthcare workers who will be heavily involved in the slum containment, and the NGOs and CBO leaders are responsible for training the general volunteers. Mobile health clinics are implemented as a way to overcome elements of healthcare barriers such as transportation, insurance, legal and financial status, and distrust of the healthcare system. Our mobile clinics will offer the following services listed here. Basic services such as food, clean water for drinking and hand washing, and sanitized communal toilets are also provided. Loudspeakers are used to deliver relevant OPVID-23 information, especially up-to-date known facts, to prevent misinformation and confusion. Finally, special consideration is made for migrant workers who are susceptible to adverse health effects from pressures to earn day-to-day. These include stipends for migrant workers who are in quarantine or isolation, paid opportunities as community liaisons, and special measures to ensure continued residence.
Now we get into our communication timeline with 4 phases from preparation to outbreak containment. I'll break these down into detail. We start with phase 1 to prepare our approach. We are mobilizing our healthcare workers for the 48-hour response to reach the Dharavi population. We are also forming 4 committees of our stakeholders and pre-testing our communications, along with implementing existing programs and infrastructure. We will consult with legal experts to confirm that our actions are ethical and within the confines of Indian and international law. And finally, we will fund machine learning programs which monitor social media and create patterns to quantify the engagement of our audience and find where misinformation stems from. This last program is unique to our response and will be tasked to Indian universities to prevent the spread of false or negative rumors about the World Cup. Here is our stakeholder coordination system for containing OPVID-23. We have government health officials connecting each stakeholder group to ensure correct case estimates and reports are given to the national government. who will then communicate appropriate containment orders to health workers in the local communities. Then we get into phase 2 on September 25th. We're putting all of these plans that we have laid into action through the governmental agencies that already exist, and we're informing the public and cautioning them about misleading information. On the right here, you can see an example flyer to show our communications, which will be concise and easy to read while not causing panic. After the 7 days of phase 2, we focus mainly on analysis to determine how effective our communication was. Using machine learning, we can identify the prevalent misinformation, quantify the international opinion of the BCCI, and monitor mass panic. We will also gather our outbreak data and use that to determine the level the ceremony will operate under. So, what is the level? This level system is risk mitigation for our event. We have 5 levels that depend on how many cases per day there are in India on October 2nd. In level 1, the event goes on as planned with masks. In level 2, we implement a midnight curfew. In level 3, we have a half-capacity ceremony and a mandatory 4-day isolation after. In level 4, we have no fans at the opening ceremony. Finally, for level 5, we have a mandatory lockdown from October 5th to 13th. We based our cutoffs on the 2020 Indian COVID-19 lockdown. These levels will be publicized during phase 2 to prepare our stakeholders for the decision, and we encourage other states to take similar but less strict precautions. We have anticipated hypothetical situations as part of phase 3 to maintain the image of the BCCI, and these responses will be informed using our machine learning data. To prevent other countries from blame for the outbreak, we will make all investigations public and use the Ministry of Information and Broadcasting to operate against these rumors. Finally, in phase 4, the Cricket World Cup moves out of Mumbai. Here we emphasize isolation, continue our campaigns, and avoid travel bans as much as possible. This month requires heavy communication with other states and nations to track the outbreak, especially around the November holiday of Diwali. This is our complete phased communication plan.
We intend to create employment and engagement opportunities for local residents and migrant workers to better inform community care and bolster surveillance efforts for future outbreaks. We will also optimize our national communication strategies through machine learning to encourage policymaking against social media misinformation. Our transparent communication and structured response will lead to increased trust between the Indian government, BCCI, and foreign nations. To achieve this proposal, the $40 million fund will be broken down into 5 parts: $6 million towards outbreak research and surveillance, $8 million to quarantine and isolation procedures, $2 million to protecting travelers in the opening ceremony, $15 million to the containment of Dharavi, and $9 million towards the communication program. As most of the cases come from around Dharavi, targeting containment efforts here is necessary in curbing spread to the rest of Mumbai and having the best chance for the ceremony to go forward. It has the highest fund allocation to support labor, supply, and infrastructure costs. Our communication strategy also uses significant funds to coordinate national and international communication efforts and to create clear, culturally sensitive messaging that prevents the spread of false information. Here are our references. Thank you for listening to our presentation, and we will take any questions now.
Judges, Q&A session.
Thank you. I think I can get started. Again, team 1, thanks for a wonderful presentation. It was very insightful. I just had one question on, so I know you touched a little bit on the phase 4, but I was wondering, given that, this whole disease outbreak is centered around a big event, I was wondering if you had any contingency plans in terms of how the World Cup itself would evolve and the logistics around that would evolve, depending on meeting different health thresholds, right? Would you make it a one city event like, NFL had these contingency plans, right? So I'm just wondering if you have a contingency plan in terms of based on how the disease might evolve over time. And what would be the different scenarios that you had planned for?
Right, so our main communication plans and contingency planning was focused on the Mumbai. So if we can stop it in the city, then we don't really have to worry as much about outward spread. But for that exact reason, we are communicating with the states very early on in phase 2. So starting, 3 days after we get this information so that we can start making those contingency plans. And if we need to move the opening ceremony so that the teams really spend no time in Mumbai and don't have a chance to be introduced to the virus, or the fans as well, we might be able to do that, but we start that communication early so we can work through the individual state systems.
Yeah, thank you so much. My question is also similar to the one Karthik just asked, but mine is specifically around these number of cases as metrics. I'm looking, today there's 200 cases, an estimated R0 of 3.2 in such a short incubation period, and we'd expect to see cases in the thousands in a few days. So I guess I'm just curious, where this 10 cases a day versus 30 versus 75 came about, and if those are, what assumptions were used, and are those realistic models?
Yes. So we based our, as mentioned, we based our predicted case numbers on the India lockdown strategy that they implemented for COVID. And so when India went into lockdown in March, they had about 94 cases per day. And that was a national number. And given the situation around other countries at the time, it was more of a preemptive measure and more protective rather than waiting for those higher number of cases. And so we also want to account for the fact that this is mainly in Mumbai, but that's why we want to stress that having the containment at where most of the cases were coming from at the beginning, and then evaluating from there will determine our case numbers and our strategy throughout.
Thanks.
And one thing I do want to quickly add is that we are using the data about 2 weeks after the original meeting to discuss the proposal. So there are possibilities that after 2 weeks we have it more under control, and so those numbers will be slightly lower.
Thank you. Thank you for the great presentation. I just wanted to ask one question. I always get a little bit worried when I hear the term mandatory, and I'm just wondering about some of your isolation strategies and mandatory mask wearing and fines around that. Do you have any idea how to enforce those?
So specifically for our foreign travelers, we're kind of basing it off of just COVID-19 and making sure it's a necessary precaution. And so I think Mumbai right now has a fine for those who don't wear masks. So it's gonna be, we're basing it off that, and it's gonna be around 200 Indian rupees, which is around like $3 US. But otherwise, let's see. Yeah, in terms of masks, that's what we're going to do. If you guys have anything else to add.
Yeah, I was just gonna say, and if there's any issues with the city enforcing mask wearing, we'll primarily have BCCI enforce it because it is a formal event, and they'll have specific strategies that I think will make it easier to enforce something like this within their stadium and properties.
Yeah.
Thank you, team. That was in the 5 minutes. Appreciate the Q&A session. Now we will transition to the presentation number 3, team number 5.
Let's move all this crap.
Mm-hmm. Oh.
Hi guys, we are ready for you. So you can join back using the leave room button at the bottom right to go back to join the main session.
Sounds good. Thank you.
Thank you.
Anna, can you tell me when the team is ready?
Yeah, so I just made the co-host. I think they should all be back in the session. So we are ready to start at 10. What time is it? 10:50. We'll be ready.
Yep. Team 5, can you check and make sure you have hosting privileges to share your screen?
Yeah, I think we're working on sharing it right now. Give us a minute. Can everyone see that?
Yes. So team 5, we are slotted to start at 10:50. Tell me if you're all ready. The entire team is ready. Do you want to wait till 10:50?
We're ready to go whenever. So we can go now, we can wait too if you'd rather.
Anna, any problems in getting team 5 started?
No, I don't think so. They can definitely go ahead.
All right, folks. Again, a reminder, please make sure that your audio is muted. And except for the presenters, I would also recommend video muting. And timekeeper Molly, are you ready?
Roger that.
All right, team 5, take it away.
Good morning. My name is Jesse Abelson, and several hours ago, my team and I were made aware of the infectious disease outbreak in Dharavi that could threaten communities and the success of the impending Cricket World Cup. As the advisory board, we can and must prioritize the lives of all people, domestic and foreign, while also considering the economic and social damage a virus can inflict. We're also aware of the unsubstantiated rumors that this virus was released as a bioterrorism weapon from Pakistan. We believe this is false, and this rumor must be addressed immediately. This is Shakib, who, like many other migrants in Dharavi, is a big cricket fan who is looking forward to the World Cup in India, but struggles with cultural identity and access to basic healthcare. Currently, his sister has a high fever, and his family fears it could be due to dengue, malaria, or something worse. Here's what we know about the virus thus far, which we have called ST23. The virus is concentrated in Dharavi. We estimate that up to 200 individuals are infected with a recovery time of 7 days. It is likely transmitted by respiratory droplets. The distinguishing features we can use to trace and isolate cases include a fever above 39.4 and oral blisters. Our R0 estimate is 3.2. That means that on average, each infected individual infects 3.2 others. An R0 above 1 means the outbreak is expanding, while below 1 means the cases are decreasing. Using an SIR model, we estimated the number of infected individuals with no intervention. With a nearby population of 30 million, without any intervention, there would be 24.4 million infected by the end of the World Cup. With a case fatality rate of 5%, that would leave 1.22 million dead within 8 weeks. With Operation Cliff, we can reduce the number of infected to under 10,000 and the number of dead to under 500. But if we're going to stop this outbreak, time is of the essence. To mitigate the spread of disease, we're using a Swiss cheese model of prevention. A single intervention will not stop the spread. However, we are confident a combination of several will. By investing our resources in isolation and quarantine, contact tracing, and mask wearing, we can stop the spread of this outbreak without canceling public gatherings. Our plan focuses on balancing the cultural and economic importance of the Cricket World Cup with actions to mitigate this outbreak. Additionally, we have plans to assure the public this was not an act of terrorism. In order to have the World Cup with minimal changes, we need to get the outbreak under control within these first 21 days and plan to do so by focusing on 6 categories. Quickly tracing the current cases and identifying the index case is vital. We'll hire and mobilize contact tracers immediately. We will create a map of the cases to find hot zones and utilize this to isolate suspected patients. Our goals are to reduce the number of infections from unknown sources by 90% and to contact and isolate at least 60% of cases, which would decrease the R0 by over 50%. We'll model our isolation response after Dharavi's successful COVID-19 response. Our first order is to brief state and health officials. We'll also set up fever camps to test residents of Dharavi and work with local non-governmental organizations, or NGOs, to establish isolation units on site for high-risk patients. For those sick enough to be in the hospital, we'll set up an isolation wing at nearby Sion Hospital. We'll also work with local healers to assure they know the signs and symptoms so they can report suspected cases. To identify the virus, we will swab patients and send samples to the BSL-4 lab in Pune, India for genomic testing. We will begin an oseltamivir trial with patients who are currently sick. There's anecdotal evidence that oseltamivir may be an effective treatment, and since it is inexpensive, generally safe, and widely available, we see no issues in beginning a trial. While we have no reason to believe the rumors of bioterrorism are true, we must prioritize genome sequencing to compare with labs in nearby areas, including Pakistan, as further proof to assure this was not an act of terrorism. To track our cases, we'll establish a command center, a 24/7 data and consultation hub that will maintain our national monitoring system and consists of a health equity task force that assures all residents are receiving proper care regardless of race, ethnicity, or status. Previous outbreaks have shown the power of misinformation, and we cannot underestimate the ability stigma can have on this virus. To mitigate these rumors, we will pressure social media companies to regulate disinformation due to the potential real-world harms this could cause. Nationally, we'll work to formulate a campaign based around transparency and awareness, being careful not to spread panic. Additionally, we will request Prime Minister Modi invite Pakistani Prime Minister Khan to India for a joint press conference along with cricket team captains from both countries, where they will all express a commitment to ending the outbreak and assuring the public this was not bioterrorism. Considering the economic stakes of the World Cup and that Prime Minister Khan is the former star of the Pakistani cricket team, we believe they will agree to this. We'll also set up a risk communication task force chaired by Dr. Poonam Singh, the director of WHO in Southeast Asia and author of Risk Communication Strategy for Public Health Emergencies. On a local level, we want to be aware of cultures, so we plan to meet with and work with local NGOs and religious leaders to find a way to make the people aware of the outbreak, distribute masks, and determine areas within Dharavi that can serve as isolation centers. We want to place a specific focus on groups vulnerable to stigma from the bioterrorism rumor, such as Muslims in Dharavi, so we will make sure several of these groups are Muslim-run and working with that community. In addition to what we have already discussed, we'll contact local experts to see if they have noticed any irregularities that may help us identify the index case. Furthermore, the state will distribute PPE to local clinics to assure physician safety. Nationally, we'll produce additional PPE as well as establishing national guidelines. Internationally, we will be reporting this outbreak to the WHO and international health regulations and requesting their assistance.
Shakib hasn't played cricket for several days because his illness is taking a toll for the worse. Shakib began exhibiting serious symptoms alongside his sister and parents recently. Community leaders brought the whole family into isolation. The local isolation camp was comfortable and secure, encouraging those experiencing symptoms to self-report. On the day of the World Cup, we will screen everyone with temperature and oral exams before every game. Umpires and players off-field will be required to wear masks and maintain as much distance as possible. Despite being common practice, using saliva to wet the ball will not be allowed. If any players show clinical signs of ST23, they should quarantine for at least 7 days. Contact tracing will be performed, and games may be postponed if multiple players are affected. As for outside of gameplay, hand sanitizer stations will be strategically located for fans and all players. We will sequester players, coaches, and their immediate families in a bubble at their hotels and enforce repercussions if protocols are breached. As for connecting with fans, we will have pre-signed merchandise, hold online press conferences, and virtual Q&A opportunities to connect with fans and the media. To avoid large gatherings in Mumbai, we plan to move the opening ceremony to Mathura Stadium in Ahmedabad. All games will be relocated outside Mumbai to limit virus spread, so hopefully Mumbai will not become known as the new hotspot to a possible pandemic. We will screen fans upon entering stadiums, frequently sanitize common areas, and regulate crowding. We also plan to hire extra security when Pakistan is playing in case of unrest. We understand that fan zones are a huge part of community and celebration for the World Cup. We will be reducing the number of people allowed in fan zones by 50% in Mumbai and have all fan zones held outside. Security will regulate crowd size and conduct temperature checks on all fans. We will also implement a registry to make contact tracing easier if anyone falls ill after attending a fan zone. After the tournament ends, our priority is to mitigate international spread. We will offer lodging to fans to isolate for at least 4 days before they travel home. We will continue our surveillance efforts and conduct temperature checks on those entering high traffic areas. To maintain international transparency, we will be in regular contact with the WHO and other infectious disease entities. Finally, we will work with airlines to ensure proper sanitation measures and screening. Our long-term goals revolve around mitigating outbreaks through targeted responses and promoting economic stability. Once the genome is sequenced, we will begin vaccine development, novel therapy identification, and start surveying for potential vectors. We will continue to monitor with targeted responses to minimize outbreak risks. We will also recommend India draft stimulus plans to mitigate the economic impacts in case of an outbreak. The Equity Task Force will remain functioning to appraise the progress and assure no group is being treated preferentially.
Our budget consists of sanitization and PPE, isolation equipment, staff salaries, testing and treatment, transportation, team lodging, fan lodging, and marketing and surveillance. We included $15 million for stimulating the economy, as we understand that moving the World Cup out of Mumbai is going to economically damage the state of Maharashtra. A more detailed line item breakdown of each category can be found in our appendix. In the case of greater spread, we have created contingency plans based on the level of spread. For low spread, we would reduce all fan zones across India by 50% and reduce the stadium volume by 25%. For moderate spread, we would consider travel and gathering restrictions while focusing on hotspot containment. If there is high spread, we would implement a national shutdown and control the borders. As for the World Cup, we would either not allow any fans in the stadium or postpone the tournament. Due to Operation Cliff, proper containment of the virus, and reduction in caseload, Shakib received the care he needed. He now clearly imagines hitting a six as a star of the Bangladeshi national team, avenging the loss his team suffered in the 2023 World Cup. Thank you for your attention. We look forward to hearing your questions.
Judges, Q&A time.
Thank you so much for the presentation. That was really great. I just had a question about, and you mentioned, I guess as the researcher in the group, what is your plan on that? You mentioned a clinical trial on oseltamivir. What was your plan for that? Was this something that you were going to plan to do as part of the committee, or were you going to look at different researchers to conduct this trial, or could you just give a little bit more details on that?
Yeah, thank you so much for that pressing question. I think Jesse is in the best position to answer this.
Yeah, that's a great question. We are actually not planning on actively conducting the trial. We would be working with local researchers, local universities to find physicians and to find researchers in likely Mumbai to actively do that trial. We did include in our budget funds for oseltamivir, so we would cover those expenses. However, the actual research would be done by an independent third party.
Thank you.
Yeah, thank you so much for that presentation. My question is, early on during COVID, even later in COVID, we noticed that a clinical symptom specifically for that was a loss of taste and smell. But then later we realized that not a lot of people necessarily experience that symptom. And so now we know that blisters and ulcers in the mouth is a clinical symptom. But there's also evidence of asymptomatic transmission. So I'm just curious how you factor in the possibility of asymptomatic transmission, or even the possibility of not having a distinguishable clinical feature into your screening, into all your plans.
I can take that one too. So one of the things, just to begin with, one of our goals is to reduce the number of cases from unknown contacts by 90%. And so one of the things that is a problem right now with COVID is that there's so much community spread from kind of unknown sources. And so that is part of our plan, is if we can get the unknown spread down, we can be not necessarily certain, but more confident that that there's not significant asymptomatic spread. In terms of the actual clinical signs and symptoms, we are prepared to adjust our plan as necessary as more sensitive or specific clinical signs and symptoms appear. So that is our plan, and we are prepared if there is significant asymptomatic spread or spread prior to conditions. We are prepared to implement our contingency plans that you briefly saw that would kind of restrict travel and movement a little bit more.
Do we have time for a question?
Yes, please.
Thank you. Yeah, thanks for a great presentation. So the one question I had is, I was curious a little bit about the funding piece that you had mentioned. So out of the 40 million, you had allocated like 15 million for economic assistance to Mumbai. I was just wondering about, if you had given some thought to whether that's the best utilization for your money, or, if you could work with the local government in terms of maybe recommending or coming up with some suggestions in terms of how to mitigate that economic loss, rather than spending a good chunk of your budget towards, economic measures. So just curious about that.
All right, I guess I'm answering all the questions today. Yeah, that's a great question, and we definitely struggled with coming up with that for a while. And so kind of our idea around that is that the $15 million will be given to the state, and the state can distribute that. We do realize that, that funding is not going to go specifically to, preventative care and kind of what, masks and all of that stuff. However, we do have all of that in our budget. And we do think that using the model that we have, we can decrease the spread so that those funds will be available for economic recovery. And as we mentioned within the long-term plans, we also talked about India drafting a stimulus bill. And so that would also be part of our plans. And we would work together with the government. Ideally, the funds are $15 million. If India is willing, would not have to be used for that. We could work with the government to give the state that $15 million from the government. However, if they're not willing, we do want that as kind of a reserve funds just in case, because we don't want to leave kind of the economic hit down to, the individual hotels, the individual restaurants that are going to be impacted by moving all of the cricket games out of Mumbai.
Thank you.
Thank you.
Thank you. That is time for our Q&A. Appreciate all the questions there. Now is a brief transition period. We'll get all the teams to stay here in the main room. And Anna, can you move the judges to a breakout room for judge deliberations?
Yep, I am opening it right now. Okay, they should be good.
Thank you. For this next part, the judges will be deliberating on your presentations in a separate room, and then we'll bring them back for their final decision. We have something planned for you. We didn't want us to be sitting in, awkward silence, staring at each other or not staring at each other. But before we go there, I want to thank three people here. We've had a wonderful group of coaches who have helped coach all our teams. But I want to recognize the three final coaches. Team 12 was coached by Rob Thames. Rob, do you mind turning your video on and waving at everyone? Maybe Rob step back. Okay, we'll wait for Rob to join us. But Team 5 was coached by Cliff Steer. Cliff, thank you. You've been a great supporter of our center in our past activities. Appreciate your effort again.
Well, Dr. Prasad, this is Cliff, and I just want to congratulate all the teams and, of course, the coaches. I think you all did a remarkable job, and I want to particularly thank Team 5, my team. They've just been a delightful group of students to deal with during this last week, and the fact of the matter is those late nights that I stayed up was well worth it. I thought they did a great job. I think all of the teams did a great job. I wish everybody the best of luck, and of course to you, Dr. Prasad, thank you again for your commitment and everything you do for this unique aspect of the Center of Global Health and Social Responsibility. I look forward to participating in it next year as well.
Thank you, Cliff. I appreciate that. And then Team 1 was coached by Jim Hart. Jim, you've also been a long-term participant in this in various shapes and forms, so I really appreciate it. A couple of words from you.
Yeah, my pleasure. Thanks, Shaylee. Shaylee was actually a public health student of mine. Oh gosh, that goes back a little while now. What?
Nearly 20 years ago.
20 years now, but we've known each other for a while. Also, I was in residency with Dr. Steer, so this is kind of a grudge match, actually. But I echo what Cliff said. It's been a pleasure working with Team 1. I'm amazed. I've been around this event almost since the beginning, and I'm just always amazed at how much can come together over 5, 6, 7 days with the visuals and everything. It's very impressive. I feel safer living in a world with you guys out there protecting our health. So thanks to all the teams.
Thank you, Jim. And another call out for Rob Thames. I saw Rob earlier. I wonder if he had to step out.
I think he had to step out for a board meeting.
Sure.
Okay.
Rob Thames has been talking to our center for a long time about participating in a lot of our center activities. So I'm actually excited that he got an opportunity to become a team coach this year. And then there's a whole list of other coaches who spend a lot of time with other teams. My personal thanks to every one of them. I know you do this out of your love for global health and student education. I really appreciate it. And now, Cliff, you thanked me. I appreciate that. But my work wouldn't be done without my fabulous team. And I'm going to bring one of my team members to keep us entertained. Erin, do you want to take over there?
Sure thing. Can you hear me, Charlie?
Yes.
Okay, sounds great. So we're going to do about 20 minutes of trivia to keep us entertained between now and the final scores. So let me share my screen.
And
all right, just another technology check. Shiley, can you see my screen?
yes, I can.
Sounds good. So let's go ahead and get started. Congrats again, everybody, for your wonderful presentations. I was watching and really enjoyed them this morning. So now's a little time to relax, have a little bit of fun while we wait. So we're going to walk through some logistics of how this trivia is going to work. So anybody on the line is welcome to play, and you can play solo or you can play as a team. So if you're one of the student teams, feel free to continue to play as a team. If you're on the phone as a staff member or as an observer, feel free to form a quick team. For the team communication about questions, you'll do that separately. So think on your feet, either set up a text group, maybe a quick email chain. You can use private chat in Zoom, but just be careful not to do it to the whole group. Grab a piece of paper or open Microsoft Word, Notes, something to keep track of your answers, and then you're going to do all the scoring at the end. So don't shout out the answers or chat the answers. I know it's fun if you know the answer, but don't want to give the other teams any advantage. As they say in Trivia Mafia, if anybody plays here in Minneapolis, use your noodle, not your Google. So I know it's tempting to look up the answers, but let's use our brains. And there's no penalty for guessing except for one question. And I'll explain that when we get there. One more logistics thing and this awesome cat meme that we get to enjoy. We'll do a couple of quick rounds, do self-scoring, and I'll give you about 45 seconds between questions. But since you're keeping track of your answers, you can continue to think about previous questions as we go. If you want to think of a fun team name, go for it. Quiz Team Aguilera is my personal favorite. If I confused you with this rapid fire set of instructions, just send me a chat. I'll try to keep an eye on that. We're playing for bragging rights, so no prizes for trivia, just for fun. I'm gonna have a little music going between questions, so don't be startled. Hopefully it won't be too loud, but just send me a chat if I need to turn the music down. Let's take about 30 seconds to get situated, get your team communication set up in your place to keep scores, and then we will get rolling. All right, I think that was about a minute, so let's get started. So round one is questions about the case, kind of. So you'll see what I mean when we get rolling, but inspired by our case. Question one, the last Cricket World Cup was held in 2019. This is a 2-point question. Name the winning country and the host country for 1 point each. Give you about 45 seconds to think about that one. All right, moving on to question two. The 2008 film told the story of Jamal Malik, an 18-year-old from Mumbai. Name the movie and the actor who played Jamal for 1 point each. Again, no penalty for guessing and partial points if you get the movie or not the actor or vice versa. And same goes for the first question. So if you knew the host country but not the winner or vice versa, you can still grab a point. All right, moving on to question number 3. All right, sticking with the same theme, inspired sort of by the case. This former and late head of state was the first woman to lead a democratic government in a Muslim majority nation. Name this leader and country for 1 point each. So up to 2 points, 1 point if you get her name, 1 point if you get the country. And I'm going to be harsh on the name. We need her full name. All right, last question of this round. So this one's the one where guessing wrong could get you into trouble. So this is a high stakes question. It's a multiple answer question, but if you get any wrong, you lose all of your points. So the question, the rupee is the common name for the currencies used in 6 countries. And these are currently used currencies, not former currencies. Name as many of these countries as you can for 1 point each. And if you get any wrong, so if you were to put down the United States or Mexico, where we don't use the rupee, you would lose all your points. If you only know one, that's okay. Go ahead and put that one down and you'll get 1 point if it's right. A hint and a clarification, it's not Indonesia or the Maldives, which have a currency that is similar to the rupee, and it's not Zimbabwe, which apparently currently uses the Indian rupee as one of its, I just gave you one, currently uses that as one of its currencies. So 6 countries, name as many of you know for up to 6 points, but be careful if you get any wrong, you lose all of your points. All right, so that's the end of round 1. Does anybody need a question repeated? I'm gonna take a look at the chat. If you need a repeat, I'll pop back up to that question. So give folks about 30 seconds to see if they need a repeat. All right, no takers on the repeat, so we can move on to round 2. So this round is in honor of the Center's own Shannon Benson, who I think is working hard with the judges right now, so she will miss this round, but can somebody from the center maybe take a screenshot or take a picture so she knows that we had a round in her honor? So all of the teams and judges and coaches got a lot of emails from our colleague Shannon Benson, so huge thanks to her for all of her hard work to organize this event. Many thanks to Shannon. So this round features famous Shannons in one way or another. All right, so question number 1. Mike Shannon is a former Major League Baseball player and current St. Louis Cardinals radio announcer. Name the team that beat the Cardinals in the 2004 World Series, ending this team's, so not the Cardinals, supposed 86-year curse. And name the curse for a second point. So it's curse of the blank. Back to no penalties for guessing. 1 point if you know the team that faced off with the Cardinals in the 2004 World Series, and another point if you know the name of that curse. And this is not a hint on the slide. There's the screenshot of the cat from a Cardinals Angels game. It's not the Angels, so that's not a clue. And this song was supposed to be in honor of Shannon. All right, so next question. And there's a question in the chat about getting the playlist for the music. Absolutely, I would be happy to share the playlist for the music. All right, and continuing on with our famous Shannons. The River Shannon is the longest river in what country? Give you 45 seconds to think about that one. All right, so that song was actually a clue to the previous question, but if you get the reference, you probably didn't need the clue. That was the baseball one. All right, so next question, famous Shannons, continuing on with other folks named Shannon. So Shannon Doherty starred in an American teen drama series in the 1990s. Name that series, and you need the full title to get the point. All right, so sad to say we are at our last question of trivia. Question 4 of our famous Shannon's round. Shannon Lucid is a retired NASA astronaut. At one time, Shannon held the record for the longest duration stay in space by an American as well as by a woman. This is going to be a music question. I'm going to play a music clip that's in honor of Shannon Lucid. I'm going to give you 20 seconds of the song, and you tell me the artist and title for 1 point each. Similar to the other questions, if you know the artist but not the title, still get 1 point, and vice versa. And again, no penalty for guessing except on that rupee question. So let me just get this set up. Have your speakers ready, and I will play it twice. I'll give you 20 seconds and then another 20 seconds. All right, so that takes us to the end of round 2. All the questions are done. Does anybody need a question repeated? Put it in the chat. Otherwise, let's take about 1 minute or so just to double check you have all your answers. And then we'll go through the answers real quickly and then move along from there. All right, so let's see how you did. I'm gonna go through these pretty quickly, so be ready to score your answers as I go. Round 1, questions about the case, kind of. The answer to this one was England and England. So they hosted and won that year. So 1 point for each England that you got right. Question 2, Slumdog Millionaire and Dev Patel. Up to 2 points for this question. In case anybody didn't notice, I did some very fancy photoshopping to the movie poster. What does it take to win case comp? I think it's destiny. Question number 3, this is Benazir Bhutto, and Pakistan was the country that she led. So 1 point for each of those, and you do need her full name to get the point. Question 4, so high stakes round. Again, as you score this, if you listed a country that's not here, I'm sorry, you lose all of your points. The 6 countries you could get here, India, Pakistan, Sri Lanka, Nepal, Mauritius, and the Seychelles. Give you a second just to double check that one. Round 2, famous Shannons. This is the baseball question. Name of the team is the Boston Red Sox, and it was the curse of the Bambino. 1 point each. Question 2, Ireland is where the River Shannon is, longest river in Ireland. Beverly Hills 90210. We need the full title. So if you're like me and just remember 90210, you would not get a point. Beverly Hills 90210 is what we're looking for. And then last but not least, Elton John, Rocket Man. 1 point for the artist, 1 point for the title. All right, and here's just a recap in case you missed any of those and want any help with the points. Let's take 1 minute to get your scores done. Send them in via chat, and then I'll announce the winner for bragging rights, and we'll be done with trivia. Thanks for playing, everybody. All right, so looks like based on folks that have sent their scores in, congratulations team 1 with a whopping 15 points. You are our winners for trivia, unless there's any dark horse team that's going to show up with a higher score. It looks like team 1 was our winner. So congratulations, and thank you for letting me host trivia. I'll turn it back over to Shiley or whoever else is up next.
Thank you, Erin. I appreciate that. I'm sure the audience is much more energized by the trivia rather than my boring talk. So, Anna, could you share our slide deck, please?
Yes, let me just getting it pulled up.
So I just want to give you folks a quick overview of what we do at the center. Our center is part of the Office of the Academic Clinical Affairs, and as such sit between the different schools within the University of Minnesota. We work as a nodal organization to catalyze, to collaborate, and to convene conversations about global health at the University of Minnesota. So we value interdisciplinary activities a lot. And for us, this global health case competition, we feel, is a practical application of interdisciplinary learning. It's not often that you work with people from outside your discipline. And the more such activities we do, the better it is for our own learnings and obviously for the complex problem the world faces. So we're very proud of the global health case competition. We feel it's a great model for interdisciplinary learning. Next slide, please. You folks are welcome to visit our website. The good news about our long name is that we are the only one in the world with this long name. So one of the things I can tell you is that if you just do a Google search for the Center for Global Health and Social Responsibility, you get our center. We have various opportunities for you to be engaged. If you're a faculty, you can avail of research grants, global health seed grants, that advance our interdisciplinary activities. Our requirement is that you have one PI from the University of Minnesota and one PI from a partner university anywhere else in the world. Applications will be open in spring of 2021, and we hope that this forms a springboard for more activity with your partner university. Next slide, please. Global Health Day is a celebration. We will be announcing shortly about our Global Health Day for spring. Usually students from across the university present. We have some presentations. We're still deciding on the format, particularly since it's going to be online this year. Next slide, please. Our annual Quee and Peterson Global Health Lecture is a highlight of an important person in the field of global health giving a presentation on an important topic. This honors the legacy of Drs. Paul Quee and Dr. Phil Peterson, who were instrumental in forming the center years ago. Next slide, please. We will be announcing our global health in a local context course. Because of COVID, we were not able to hold it this year. We are planning on holding it in fall of 2021. And I hope you all look at this, and it is an interdisciplinary course, so you can get credits for it too. Next slide, please. We have various opportunities within our center. Feel free to contact us. There's obviously information about the case competition here, but contact us in a general email and you'll get more information about our center. Next slide, please. So, Anna, are the judges back in?
They are not yet, so I'll pop over into their breakout room and see if they're ready to come back.
Perfect, thank you. We will be sending evaluations for our.
So who is volunteering for that?
I can do it.
Yay, thank you, Mateo.
How are you guys doing? Are you just about ready to come back?
We are. I'm just texting Shiley. So just to confirm, third place is team 1, second place is team 12, and first place is team 5.
Yes.
Yeah.
What was that?
Yep.
Yes.
Yeah.
Okay. I hit send. So Shiley just got that message, Anna. So I think I was giving him a 1-minute warning, but I think we're ready.
Okay, so you guys can come back using there's the leave room button at the bottom right of your screen and select leave breakout room, not leave meeting, just leave breakout room, and then you'll come back to the main session.
Okay.
Thank you.
All right, our judges are back in the session.
Thank you, Anna. Again, Karthik, Joshua, and Mateo, really appreciate the time you spent in this and your expertise in this field, obviously. We will look forward to future conversations after this too, okay? And now, before I do the announcement for the winners, I would like to remind the winning team to stay back. We would like to get a screenshot, obviously, with the winning team in. So I'm going to announce this first. The announcement is going to be for the third place team. The third place team is team 1. Thank you, team 1. Appreciate the input you've had in your case presentation. And then now, obviously, the winner is between the other two teams, right? So I don't think I should keep the suspense up for too much. The first place team is team 5. And team 12 is the second place team. Thank you all. I really appreciate this. Can I get the judges to make some quick comments about your experience and the way you've decided this? I'm going to bring in Karthik. Can I bring in you first?
Sure. Yeah. It was I think it was a fascinating set of presentations, and we all thoroughly enjoyed listening to all 3 presentations. And it was a fascinating conversation, even in the breakout rooms between the judges. So we had, just to make it more streamlined, we had nominated Mateo to consolidate all the judges' thoughts. So we can either do that or we can give individual feedback, whatever works for you.
Either way is fine.
Okay, so I think maybe Mateo, maybe you can give the group feedback and then we can add on if you're missing something. Does that work?
Yeah, Karthik, I think that works great. And I think it'll be helpful for us to all kind of, because we were bringing in different lenses that I think they'll appreciate. I think the one really big thing that we were looking for is for this response to be centered around the immediate kind of threat, which is a huge mass population event, right? So we really wanted to see a strong emphasis on everything before that event, right? Because that event is naturally going to bring a lot of people. So we wanted to see really strong and robust prevention measures, but then also some really thoughtful consideration about contingency plans, right? Is it gonna change locations? Is it gonna, be virtual? Is it gonna change, the format? How are you gonna, consider all those factors? And another really important thing to think about, and right, really drawing from lessons learned during COVID, is it's really hard to ask a population to do something when you're not really engaging them and meeting some pretty basic needs, right? So we were looking for ideas and plans that got creative around bringing people to the table, engaging them in the work, making sure that basic needs are met. So those are some of the factors that kind of came into our deliberation. Karthik, Joshua, anything to add?
Yeah, I mean, I'll just add, this was a really fun experience. I think all the teams did really great. It was really a difficult decision for us. And nice being able to work with the other judges too, and everybody coming in with a little bit different perspective on things. And that we will, over the next couple of days, we'll also try and summarize all the specific feedback and send around to the teams as well. It was just a little bit harder to do kind of on the fly as we're listening to this. But really it's been a joy being involved in this. And I thought all the presentations were really fantastic.
Yeah, and I'll just add on to what Josh said. I think the one thing, we discussed and what we really liked was all the teams, had a consistent baseline framework. Nobody was going just based on like one or two dimensions. All the teams had a pretty thought out, comprehensive approach, in terms of the different aspects of dealing with outbreaks, whether from testings to supplies to response. So they all had a pretty good, solid underlying framework, which we liked. And then each team also had sort of some unique aspects that they brought to the table. So it was not like a one size fits all approach. I think they all had a good foundational framework, but every team sort of had their unique take, in terms of whether it is information or whether it is the local context. So that's something that we really liked across all the teams.
Thank you. Any questions for the judges? I'm going to try and see if I can put them on the spot. Nope, good. Shannon, can I bring you in to talk a little bit about what this means in terms of the prizes and the next steps, please?
Sure. Congratulations again to everybody. All three of you really did a fantastic job. I'm so proud. I feel like a mother hen here. I get teary every year, and being virtual doesn't change that. I'm really proud of all of you guys. So the top two teams, there is a cash prize, which I'll be in touch with you by email to kind of figure out some logistics for that and get some information and get those processed. And then team 5, our number 1 team, you will be going on to compete in Emory's virtual competition. The dates of that are March 12th through the 21st. Like I mentioned in our team training, we really try to model that format, so it'll be similar to what we just went through here. Probably something a little bit different, but Dr. Steer can kind of tag along for that too if he's available. You will be provided some additional advisors from Emory for how their process works, but mark your calendar now and we'll be in touch. I think I'm really proud of everybody, really thankful to the whole center team that helped pull this off and move it from a live event to this virtual platform. I think it went well. And again, just congratulations to everybody. All of your time and lack of sleep this past week has really paid off. You did a great job, all three teams. Congratulations.
Thank you, Shannon. We have one question, Joshua.
Yeah, I came up with a question for the judges. I just want to thank all of y'all who put this competition together. You did such an amazing job, and I think I made some lifelong friends with my team, and something that I was never expecting. But going on from this competition, how can we continue in our global health journeys and empower ourselves to be future leaders and change makers. Thank you.
Josh, can I get you to answer that quickly?
Sure. I mean, I think, Shiley, I'd like to hear your thoughts on this too, but I think it's just a matter of following your passion, doing what you enjoy doing. I think whatever field that you're pursuing or that you're currently doing your training in, I think that there's always going to be a global health component to it. And if that's part of your passion, follow what you do and always, be thinking about, for me, it's been research, and I've been able to, add a global component to that research. For others, it'll be, whatever your primary discipline is, I think adding, there's a global component that can be added, and just sort of keeping your eye on the prize and thinking of outside the box on how you can make that into a career is the advice that I have for that. Happy to hear how other people have sort of come to that journey.
Thank you, Josh. I couldn't agree with you more. I feel that global health is a team sport. There's so many of us coming from different angles, different backgrounds, different interests. And trust me, you will find an area that will fit in both your technical expertise that you're going to build as a professional and your personal passion too. Matteo, any thoughts on that?
Yeah, I think, for me, what was really important for me to understand in this transition from like in theory to practice is how much harder it is in practice than it is in theory. And more importantly, that kind of the tools and the lens with which we view, global health principles are really applicable to anything, right? Especially in a local context, right? Community engagement isn't just done in settings abroad because they only work in settings abroad. They're done because they work everywhere. And I think our current crises right now shows the importance of using, public health tools and global health tools in a local context. And I'm pretty sure the Center for Global Health has some pretty cool courses on exactly that.
Thank you, Matteo. Karthik?
Yeah, amazing comments. So to me, there is three things that come to mind. At least, it's been always there, but COVID has made it even more salient. I think the first one is the importance of taking a systems perspective, right? So it's nothing operates in silos, or nothing operates in isolation. So the connection between social, economic, and health aspects, I think that's something that is coming more and more into prominence because of COVID. How we need to think about all these three aspects together, and taking a systems perspective rather than looking at problems from just an economic lens or a health lens or a social lens. It's really important to connect the pieces together. The second thing that is also important is the interconnectedness of both geographies as well as different fields, right? So it's no longer health problems in just one geography. COVID has exposed like how the world is interconnected. What happens in one part of the world, how it connects to other parts of the world, and how it can make or break systems all across the world, right? So that's something that again, it's always been there, but I think has become even more important and salient because of COVID-19. And then the third, I think, is planning for uncertainties and contingencies. That's something that is really, really important to build resilient systems for the future. Because we need to think about how systems can be disrupted, what uncertainties there are. And we also need to think about how will we recover from those if we want to develop more resilient systems for the future. So I think thinking about uncertainty and contingencies in a proactive way, I think is another thing that comes to mind because of COVID-19. So those are the three things that I wrote down. So thank you.
Thank you, Karthik. And Cliff, I saw your hand up.
Yes, Shiley, I just wanted to, first of all, as the coach of Team 5, the winning team, I wanted to congratulate my team for doing just really a superlative job. I think all three teams were winners today. There's no doubt about it, as were the group of people who were on this Zoom meeting. And I want to congratulate Dr. Prasad, Center for Global Health and Social Responsibility, Shannon, Molly, Aaron, the entire team that really put together a superlative case competition. And finally, I want to thank the three judges. You know, I watched all three presentations, and I got to tell you, I think they were all winners. So I really appreciate the thought and also the time and the effort that the three judges put into this. And of course, Shiley and Katie Griffin know that I've been involved with the Center of Global Health and Social Responsibility for an extended period of time. And simply stated, I feel very privileged to be part of it. So I wish everybody a happy new year and well-being, and above all, good health and a prosperous 2021. And again, thank you all. And Team 5, you did a great job.
Thank you, Cliff. And Joshua, my personal thanks to you. It was a beautiful way to bring a question in so that we could all reflect on why we're doing this, right? Team 5, Jesse, Sarah, Paige, Reese, Christopher, Kelly, congratulations. Any quick thoughts? You can't say I'm going to Disneyland. That doesn't count.
How about the Super Bowl?
Thank you. No, we seriously are so thankful to have had Cliff as our mentor. We had a really great time working together this week. Maybe a little too much fun sometimes, but this was a really great learning opportunity. So we're really thankful to have been part of this.
And my personal thanks to my team from the Center for Global Health and Social Responsibility. Shannon has been sort of the quarterback of this operation. Others, Anna Pendleton, Katie Griffin, Molly McCoy, Erin Mann for the fabulous trivia and that soundtrack. Scotty and Sol Perez. I saw Sol earlier contributing from Argentina. Thank you all. We couldn't have done this without you. And I think we've had so much fun in the online format. We are really seriously wondering if we should just stick to the online format from here onwards. We'll talk about this down the line. Again, thank you all. I would please request Team 5 to stay back. The rest of you, have a great weekend. Bye.